We are the Sweet Peas, and we are here to present our pitch for the development of Interprofessional Diabetes Care Clinic in Surrey, BC. Inspired by Jane's quotes, you miss 100% of the insulin shots you don't take. Wayne Gretzky, Michael Scott, the Sweet Peas. In response to the high prevalence of diabetes, we are proposing an integrated program of healthcare professionals to provide diabetes education, prevention, and chronic management services. It will be a fee-for-service model accessible through physician referrals with a focus on integrating clinical pharmacist consultations.
The need for this service is clear. Diabetes affects a third of Canadians. In 2019, there were approximately 3.4 million Canadians living with diabetes. This number is expected to rise to 5 million by 2025, and the yearly cost of treating this disease will skyrocket from 14 billion to 20 billion in the next decade. We chose to operate out of Surrey because around 50% of the population are high-risk individuals for developing type 2 diabetes, so we can expect high demand for our service. Additionally, there is no service similar in this region. Surrey Central is easily accessible through public transportation and is close to local hospitals and physicians.
With the combined efforts of our clinical pharmacists, endocrinologists, and other healthcare workers, our clinic will provide integrated services such as prediabetes care, optimizing drug therapy, chronic disease management, preventing disease progression, and implementing lifestyle changes. Pharmacists are medication experts and are excellent resources for diabetes care. Those employed here will be required to be a certified diabetes educator to ensure that they provide the best quality care possible. Each patient will be referred to us by a physician. They will then be differentiated as pre-diabetic or patients requiring chronic diabetes management. Pre-diabetic patients will receive diabetes prevention and education services from a clinical pharmacist and physician. Chronic diabetes patients will receive diabetes and comorbidities management through clinical pharmacist and endocrinologist consultations. Patients may consult with additional allied health professionals too if necessary.
The target market, as mentioned, is within Surrey. There is an inpatient diabetes program at Surrey Memorial Hospital. However, there is no outpatient setting for which we hope to set up a referral program with Surrey Memorial. Finally, we will target family physicians who may require additional support for complex diabetes patients. We hope to gain a positive presence within the community. Specialists such as endocrinologists have long wait times, and patients often go untreated while waiting for appointments. Diabetic patients are often complex with multiple comorbidities. For these reasons, patients would benefit from a more holistic healthcare approach. Our goal is to reduce the overall strain on the healthcare infrastructure and cost. We will do this by reducing and preventing acute complications through an increase in accessibility to specialized diabetes services. We will provide the convenience of multiple healthcare professionals in a single location with interprofessional collaboration.
What sets us apart from the rest? We are the only outpatient diabetes management clinic in the Surrey area. We're also advocating for a holistic view of diabetes management, touching multiple components of treatment by promoting interprofessional collaboration. We want to build a safe and open practice by personalizing each patient's treatment according to their specific goals. By doing so, we can build honest and long-lasting relationships. Finally, we are helping patients better understand their condition and recognize it is only one aspect of their life. For our marketing strategy, to increase our referrals, we will organize lunch and learns with local family physicians, organize a pitch for a referral program directly through Surrey Memorial Hospital. Brochures and posters provided to offices and community centers will be available in English, Punjabi, and Mandarin. To maintain effective public relations, our online presence through Facebook and our website will be updated on a regular basis. We will participate in local events to showcase our benefits. And finally, we will contact BCPhA and local media outlets to gain maximal exposure.
In order to fund our plans, we identified 4 sources of funding: 2 grants, personal investments, and a business loan. In total, we'll have $335,000 to start up our business. We estimate startup expenses of approximately $253,000. Major startup expenses include pharmacy inventory and rent, as we don't expect to be profitable in the first year. Our major monthly expenses include employee salary, monthly rent, and loan repayment. Our clinic provides a variety of services from various professionals. Here's some of our fees and who we expect to bill. We predict 20% of appointments booked at opening, and at the of year 1, this will rise to 85%. We expect to start making profit in month 11. At the end of year 2, we will be 95% booked. We expect to maintain this percentage in year 3. If we are successful in year 3, we will then decide to expand our weekly hours from 24 hours per week to 30 hours per week.
So when we are looking at the performance of our business, we'll be looking at various indicators. First of which is appointments booked, which will be evaluated as a percentage of our booking capacity. We will also be considering the services utilized by these appointments. The second indicator is our profits. We will have quarterly reports, which are stratified by the clinical services and dispensary. Lastly, we will offer a patient feedback form where patients can let us know where we can improve and what services we may be lacking. When we look at the future of our business, there are two outcomes. Initially, we will determine if our clinic is in demand based on the quarterly reports. If we have a very positive long-term projection, we will extend our operating hours, change our on-call services to full-time, and we may add additional services and health professionals. If we happen to be projecting negatively, we will reduce our hours to adjust for the demand and increase our marketing to bring more awareness. We will establish a business floor based on the percentage of appointments, expenses versus revenue from the quarterlies, and we will look at the remaining funds that we have left. If we happen to close, we will notify our patients and local clinicians via email or phone call. Thank you for listening to our presentation.